So this is Abby, and she's from Scandinavia. She's been a chronic smoker for over 10 years. Abby has recently been diagnosed with emphysema. We're going to teach her how emphysema affects the body and why it affects the body the way it does. First of all, the major risk factors and causes for emphysema include smoking, a hereditary deficiency in the protein alpha-1 antitrypsin, and being of Scandinavian descent. The signs and symptoms associated with emphysema include shortness of breath, excessive mucus builds up in the lungs, throat, and nose, difficulty breathing, and an abnormal cough or wheezing. So this is what a normal set of lungs should look like. The bronchiole branch into bronchioles, and the alveoli are used for gas exchange. In emphysema, there is a loss of lung elasticity and enlarged air spaces. Here we are going to thoroughly explain why. So normal alveoli has the protein elastin, which helps to keep their shape and recoil while exhaling air in your lungs. In emphysema, the alveoli lose their shape and elasticity due to the breakdown of elastin by the protease elastase, causing difficulty exhaling the CO2, and the air just stays in the alveoli. Without the elastin to hold the wall shape of the alveoli, the air trying to escape pulls the alveoli walls outward, causing a collapse of the walls and therefore even more obstruction to the air trying to exit. Now CO2 cannot escape, making it even more difficult for the person affected by emphysema to breathe and gain oxygen throughout the rest of the body. On top of these characteristics of emphysema, another common cause is due to the hereditary deficiency in the enzyme alpha-1 antitrypsin. Normally, the lung is protected from proteases, particularly elastase, by the alpha-1 antitrypsin. A deficiency in this means a weakened defense against these proteases. Therefore, the breakdown of elastin by elastase becomes more prevalent. This gene deficiency causes a destruction of the elastic fibers in the lung. In relation to smoking, the carcinogens increase the risk of emphysema in people with a deficiency in the alpha-1 antitrypsin. As a result of carbon dioxide being trapped in the alveoli, respiratory acidosis occurs and the blood becomes more acidic. The pH will be below 7.35, and the pressure of carbon dioxide in the blood will be high, usually over 45. Because air is trapped in the alveoli and the lungs themselves become enlarged, causing a barrel shape of the rib cage, which is a noticeable physiological change to the body. So to summarize the key concepts of physiology, homeostasis, proteins, and the cell membrane, the two most important concepts in this particular disease are focused on proteins and homeostasis. With any disease, homeostasis is always affected in many different ways. In emphysema, particularly the normal gas exchange in the lungs is affected. As for proteins, the elastin in the lungs usually holds the wall shape and allows for effortless inhalation and exhalation. Because elastin is broken down by the protease elastase in emphysema, the alveoli can no longer push air out of the lungs, causing difficulty with gas exchange and breathing properly. The enzyme alpha-1 antitrypsin usually protects the elastin, but in people who have emphysema, the deficiency in this enzyme adds to the breakdown of elastin. So to relate it back to Abby, so emphysema can't be cured, but treatments can help relieve symptoms and slow the progression of disease, such as bronchodilators, inhaled steroids, and antibiotics. So to change her lifestyle, she should stop smoking, avoid respiratory irritants, exercise, and prevent respiratory infections.